Hi, this is my newborn assessment video. I'm doing my room sweep. I've got nothing over there, nothing over there. My scrubs don't fit, so this is the best that I got. Um, okay, so I have my baby. I'm gonna start by introducing myself to the parents and going into the baby's room and doing all those things. So, knock, knock, knock. Hi, my name's Alyssa. I'm gonna be the nurse today. I'm gonna wash my hands and I'm gonna be performing an assessment of your newborn baby. Um, it should take me about 10-15 minutes and I'll kind of explain everything as I go. So I'm going to start by looking at baby's head. I'm assessing the anterior fontanelle and the posterior fontanelle, making sure that they're present, not bulging or sunken in. If they're sunken in, it could mean the baby's dehydrated, and if they're bulging, it could mean the baby has some excess fluid on the brain or increased intracranial pressure. I'm also assessing the shape of the head, making sure that it's nice and round and symmetrical and even, making sure that there's no cephalohematomas or anything like that on the head, making sure that the suture lines are present and that they're not fused and that there's no molding. I'm going to measure the baby's head. We're going to pretend that this is a tape measure, and I'll measure around the widest part of baby's head, and I'll get my answer in centimeters. I don't have a tape measure, so that's what I got. From there, I'm going to look at the baby's eyes. I'm going to make sure that they're symmetrical, that they're not too far in towards the nose, not too far out. Making sure that they're even with the ears so that this part is even, this part of the ear is even with baby's eye. If it wasn't, it could indicate something like Down syndrome or other genetic problems. I would use my pen light to assess baby's pupils, making sure that they're equal and round and reactive. From there, I'm going to look at baby's ears. I'm going to feel them, make sure that the cartilage is intact, bend them a little bit, make sure that they're flexible, move the earlobe, move the tragus, make sure everything moves around okay. Make sure that there's no skin tags. If baby had skin tags on their ears, it could indicate kidney problems. From here, I'm going to look at baby's nose, make sure that it's symmetrical and everything. I'm going to test nasal patency by using my scissors here, and we'll just place them right under baby's nose and make sure that when baby breathes out the nose that I get 2 little round circles from each of the nares. From there, I will look at the mouth, making sure that the gums and the lips are moist like they're supposed to be, things like that. And then I will use my gloved hand and assess the sucking reflex. I will place my finger in baby's mouth. Baby should then suck on my finger. Whilst it's in the baby's mouth, I will feel for the hard and soft palate, making sure that there's no cleft palate. While I'm looking at the lips, making sure that there's no cleft lip or anything like that as well. Then we'll do the rooting reflex. So I will lightly brush baby's cheek. Baby should turn its head and open its mouth, looking for mom's breast to feed. It helps baby know where the breast is, and it helps baby know where the breast is to feed. Okay, from there, we will unwrap the baby. We're going to look at baby's arms, making sure that they move around okay, that they're flexible, good motion. I'm going to feel for brachial pulses on both sides at the same time, making sure that they're strong, symmetrical, and that if they were not symmetrical, it could indicate heart problems. This whole time I'm looking at baby's skin, making sure that it's clean and intact and warm and pink like it's supposed to be. I will test the baby's grip reflex. I'll place my finger in baby's hand, and baby should grasp my finger. And then from there, I'm going to count the fingers. So we have 1, 2, 3, 4, 5. 1, 2, 3, 4, 5 on either hand, making sure that we don't have any extra fingers or missing fingers. I'm going to assess baby's clavicles, making sure that we didn't have any issues with shoulder dystocia in labor or things like that, making sure that they're symmetrical and no pain when we move baby's arms around. From there, I'm going to listen to the baby's lungs. So we're going to listen in 4 spots here. I would be using an infant stethoscope, but I don't have one, so we'll listen in 4 spots for baby's lungs, and then we'll listen to the heart in the different spots, the aortic, pulmonic, tricuspid, herbs, mitral, and then at the mitral we'll get our apical pulse, where we'll listen for a minute. For that I got 130, and for respirations I got 34 from watching the video. I'm just watching baby breathe, making sure that we're not using any accessory muscles or that there's no lung retractions happening, because that could indicate that baby's in respiratory distress. While I was listening to the lungs, I was listening for crackles or wheezes. It's normal if baby is just born that their lungs could sound a little bit wet, but we just want to keep an eye on that. When we're listening to the heart, I'm listening to make sure I don't hear any murmurs. A murmur could be present if that ductus arteriosus has not closed yet. So if that's the case, then we would want to probably consult cardiology and just keep them in the loop and following up. From there, we're going to test our Moro reflex. So I will take baby's 2 hands and I will lift baby up off the edge of the table. And I will drop baby. Baby's arms should flail out as a startle, and then they should retract back in. If they stay out and startled for a really long time, it's a hyperactive response, and that could mean that mom potentially used drugs while in the womb. From there, I'm going to look at baby's belly. I'm going to listen to baby's bowel sounds. I'm going to ask mom how feeding is going, if you're doing breast milk or formula, when the last time was the baby fed, and just assessing, making sure that it's going okay. I'm going to palpate the baby's abdomen, just making sure that it's soft and not firm. I will ask the mom if baby's passed its first meconium stool yet. If it has, it has. What does it look like? I would want to know. Things like that. I'm going to look at baby's cord, where the cord was, making sure that there was 3 vessels present in the cord, that it's clean, that there's no redness or discharge coming out of it. It should be clamped and starting to dry up at this point. From here, we're going to remove baby's diaper. If baby was a female, we're looking at the labia majora and minora, making sure that they're present and intact. They can be kind of swollen just from mom's hormones and things like that. They can also have discharge, but it should go away. If baby is male, I'm looking at the testicles, making sure that they've dropped and that they've descended, and feeling to make sure that they're descended. I'm looking at the tip of the penis to make sure that the urethra is centered and that it's at the tip of the penis where it's supposed to be. I would ask the parents if they're interested in circumcision, and then we would discuss that further if they were. We'll place the diaper back on. From there, I'm going to look at baby's legs. I'm going to feel my femoral pulses, making sure that they're strong and even. Making sure that they're strong and even. I'm going to move baby's legs around, make sure that they can move okay and that there's no pain or resistance or anything there. I'm also looking at skin this whole time, making sure the baby doesn't have any strange skin problems going on. I'm going to count the toes, 1, 2, 3, 4, 5, 1, 2, 3, 4, 5, making sure that all 10 are there, no extras. Making sure the baby's skin is warm, pink like it's supposed to be, that the feet are pink and the hands are pink, making sure that there's no acrocyanosis still present. From here, I will weigh the baby, so I will have zeroed the scale with the diaper on it. I'll weigh baby with just the diaper on. I'll place baby on the scale, get my answer in grams, and then I will measure baby from the tip of the head down to the feet. Again, I don't have a tape measure, so I'm using a string. From there, we're going to flip the baby over gently, and we're going to look at baby's back and making sure that the spine is straight, that there's no spinal dimples or meningoceles, which could indicate spina bifida, and making sure that there's no Mongolian spots or stork bites on the baby's back. I'm going to look at baby's bottom and make sure that the gluteal folds are symmetrical. If they were not, this could indicate hip dysplasia. Looking at the back of baby's head one more time. Again, doing an overall thorough check of the skin, making sure that it's warm, pink, intact, that there's no skin concerns or bites or spots or anything like that, because any spots would want to be documented. From there, we'll flip baby back over, and I'm just going to check an axillary temperature, making sure that that's good. And we're done. I would wrap baby back up, explain to mom and dad what we did and that everything looks great. Ask them if they have any questions, answer their questions if they had any. Let them know that we'd be back, make sure they have their call light and all those things and that they don't need anything else. Wash my hands and leave.